Hi, my name's Leonard Jason, and I'm within the Community Psychology PhD program and also the Clinical Community Psychology PhD program at DePaul University. My interests are in several different areas. I'm particularly interested in individuals who are living in recovery homes and how these types of recovery homes, called Oxford houses, can help people readjust back into the community. So, for example, a lot of people come out of jails and prisons and they often don't have safe housing or jobs. We're trying to understand how these Oxford houses provide people both safe housing and jobs. Oxford Houses has been an organization that I've been studying for over 2 decades. We have a very good collaborative relationship with the organization, and we've done many studies with them. It's a completely self-governing, democratic organization. There's no professional staff. Each house, and there's over 1,600 of them, makes its own requirements as to who can come in and how people can stay there. In addition, these particular Oxford houses self-govern completely. So it's a very interesting thing from a community psychology point of view. There's over 10,000 people that live in these Oxford houses, and one of my interests was to try to figure out kind of different types of phenomena in terms of empowerment, sense of community, social networks. All these types of things can be studied in these recovery homes around the United States. A second area that I do work on is also involving a chronic illness, and I'm particularly interested in individuals who are stigmatized, people who are marginalized. I've been studying for, again, a couple decades, a particular phenomena that's called chronic fatigue syndrome, or MECFS. And individuals with this illness are often not appreciated and not given particularly good medical care. So we've done basic research in terms of how many people have this illness, called epidemiology, to characteristics of people with this illness, as well as case definitions, and trying to come up with better ones. We do a lot of policy research within the chronic fatigue syndrome area, as well as within the Oxford House area. We write policy briefs, white papers. We try to really make a difference. The research that we do, I would say the most important part of it is we don't just publish stuff to sit on bookshelves. We really try to publish stuff that is actually have an impact. So as an activist stance, that's one of the things that we do in my particular shop. I'm the director of a Center for Community Research, and at that particular center, we focus on these areas and others as we try to focus on bringing social justice to particularly people that are marginalized, people who don't have a voice, people that don't have the resources that they should have, and those are the ones that we're particularly interested in working with. You know, my values really involve what's called social justice, and how does one get towards social justice? And I often think about principles of social change. And these are principles that I've been thinking about, working with on different types of areas for many years. And I think the most important thing is you really have to have a passion, really have to care about something strongly. Because if you do, you're likely to stay with it longer. So that's one of my values. For myself and for people I work with, how do you find something that you really care about? Once you care about something, you really need to think about, are you doing a Band-Aid approach or really much more of a structural second-order approach? If you really want to make some type of structural environmental change, something change the rules, the roles, then you're going to actually focus on power abuses. So another value of mine is that if you really want to bring about change for anything important, you're going to have people with vested interests that you're going to have to try to make them change the way they're either controlling resources or how they're implementing policy. If you want to kind of work on second order change, and if you want to work on what we think of as power abuses, then the best way of doing it is by having community coalitions. And those coalitions with yourself and them can actually try to make a difference. And that's the third principle of social change that I've kept working with over the years. Really the fourth thing is kind of having that long-term patience, and sometimes having small wins helps one kind of stay committed to an area. And if you have that passion and commitment, you're also likely to stay committed. And the last principle is really fine-tuning your interventions over time with feedback loops. I've used these 5 principles for just about every type of intervention, any type of collaboration, any type of work that I've done with community groups over many years. And whether it's working with chronic illness, whether it's working with addiction, whether it's working with different types of populations that are often underrepresented or underserved, that's the types of things that basically I see that makes a difference. The other thing that's so important with our values is kind of trusting your intuition, trusting your hunches. And to give kind of a quick example of that, one time I was doing an intervention with the media, and we were trying to decide, how we could work with different types of community partners, putting on a large smoking cessation program. And McDonald's approached us, and they said they wanted to give out self-help manuals as we did a media smoking cessation program on the news. And my values and my gut feelings were, don't involve McDonald's. Even though they would give us a lot of money, even though they would be people that could distribute a lot of these self-help manuals freely to hundreds of thousands of people, I refused to basically let them be involved in a health promotion program, particularly given the types of foods which are not particularly healthy. So if you have a health promotion program, you've got to think about your values, and you've got to think about your gut instincts in terms of what helps drive you toward making critical decisions during these interventions. My near-term goals are really to kind of work with myself in terms of trying to find the things that really I care about, things that I want to sort of make a difference in the world, and also working with students to find out what they most care about so that they can make their kind of hopes and dreams alive. The things I really enjoy the most is, when I see the creation of a new setting. So, for example, at DePaul University, I helped with Joe Ferrari to establish the Community Psychology PH.D. program. That was a short-term goal that became something really important because now we've had many students come through the program. I also was involved in helping design with Oya Rabin the undergraduate concentration in community psychology. So that was another short-term goal that's become a longer-term goal. How do we make settings that provide opportunities for undergraduates and graduate students to get involved in the field of community psychology? So those are some of the types of goals that I've had with my own institution. And I do believe, very importantly, that we as community psychologists shouldn't just have these types of intermediary and long-term goals that involve us working just with people outside the university. I think it's just as important for us to think about what can we do internally to revitalize or to create new programs. Other examples of things that I've done at DePaul University, I taught a course in the 1980s where I began to help students write grant proposals. So now that particular course has become a regular feature of our graduate program, where students learn how to write grants as part of their training. So again, an institutional piece that I helped to develop within my own setting. Another thing that I worked on kind of over the years, even earlier, was developing a concentration for undergraduates in human services. So that's another program that we developed that actually I think has made a difference. A final thing, I've had a commitment to our clinical community program since 1975 when I came to DePaul University. So for many years, I really have been thinking about kind of institutional ways of providing training for clinical community psychologists, for community psychologists at the graduate level, and also at the undergraduate level. So one of the things that I guess I'm sort of emphasizing is that we try to make change often with community organization and groups, but we can't miss the opportunity, even internally, to try to help enrich the settings that we live in, the settings that we work in, because ultimately that might be the greatest way that we're able to bring about change in the training of new students over time, as well as collaborators who participate with us in our activities. What I expect for TA or GAs that I supervise is really the starting point of, do they care about what they're doing? If basically they're working on something that is not something that really is meaningful to them, that's a problem, because they're not going to be passionate about it, they're not going to really care about it, and that'll show. So I guess the first thing that I do when I kind of work with students is try to find something that is meaningful, something that they want to work on. Usually I try to select students to work with me that have an interest in one of the areas. I do a lot of work in health psychology, and often trying to understand chronic illnesses, trying to understand stigma associated with them. We're also trying to understand addictions and some of the issues that people face with addictions. So to the extent that people have interest in those arenas and particularly if they have an interest in policy level types of interventions, trying to bring about change at both a state, a local, and a federal level. Those types of students are probably going to have the greatest fit with the types of stuff that I do. So there's a real important issue of fit between myself and the student. And when that fit is there, that's great, because there's much more likely that they're going to be working on something they really care about, and I'll also be seeing that they're really interested in what they're working on. So that fit is really important in all the types of work that I do when I supervise students who are either TAs or GAs. I have had some good experiences in mentoring and supervising GAs and TAs over the years. One of the things that I'm most proud about is when people who I've worked with get back to me, send me emails, or I have a chance to talk to at conferences or conventions. And I do stay in touch with quite a few people who I've worked with over many decades. So when someone basically publishes an article, basically writes a book, those things are important. Those are academic things. When a person becomes an assistant or associate or full professor, those are important achievements because they have a chance to influence others. But those are not the only things that make me feel very proud. I feel very good about the situations of students who are able to go into the communities and actually work with grassroots organizations. That's another type of experience that students come back and tell me, that they've had a chance to work with an organization to actually make some policy changes, sometimes in Washington, sometimes in other state capitals. So when students come back and they tell me that the types of things that they've learned at DePaul have allowed them to go and work in academic institutions or to work with community organizations and to make a difference, to make this world kind of a more just place with more equitable distribution of resources. Those are the types of things that get me excited. And I must say that probably a week doesn't go by without me hearing from somebody that I've worked with in the past who can tell me some of the things that they've done and actually make me really feel positive about the types of supervision that I've been able to have with students over many years. Examples of successful people that I've mentored really go from a person who gets their degree and is able to have a job that's either working with a community organization, working with a think tank, working with a political organization that possibly is impacting policy, working at an academic setting where they're having a chance to train new students as well as do their research. You know, I've been fortunate to have students in all those particular areas. I think the key thing that's important as I work with students is that whatever they do in any of these forums, that they don't become just a person who's content with what they've learned in graduate school. So to the extent that a person is a continual learner, and that's really what's going to be important for the next 30, 40 years of their career, that whatever they're doing, they have to keep being one step ahead, one step kind of to the next area that, in a sense, possibly wasn't even developed. The internet wasn't even around 10 years ago, and now it's so much a part of our life. So 10 years from now, there'll be new types of media that people are going to have to become comfortable with, to try to communicate with others through new mechanisms, whether it's Twitter, whether it's YouTube, whether it's new types of ways of even disseminating information through courses online. To the extent that people are excited and really kind of say, gee, I want to keep learning, I want to keep changing, I want to keep sort of making a difference in different ways, that's what's most important. And to the students that are able to do that and capture that enthusiasm for learning and for change, that's the piece that's most exciting. When I see that, when I can cultivate that, both in myself and others, that's what's most meaningful to me. My expectations for a thesis and dissertation is that it's important, that the person really cares about it, that it has the potential of making a difference, both in the local area that they're in, which might be DePaul University, the Chicago community, or the larger context of our society. So